Good morning. Today we're going to talk about hair loss, especially in middle age and women. I am marinating myself, so I've got this oil that I made. I had posted a video on it with hibiscus and lotus seeds and things like that. So I've put that in my hair to kind of moisturize and hydrate my scalp and to massage it. Basically, that's what it is. Some of the oils are very heavy, so you got to be a bit careful what you apply and wash them off thoroughly. My hair loss started in my 40s. So I used to have really thick hair. Literally, my plate used to be that thick when I was in school. And over the years, doing chemical processes such as straightening, perming did affect my hair. But because of the good genes, it did grow back quickly. In 40s, I noticed a huge hair loss. Most of my carpets in my bathroom would be covered with hair. So few things were happening. I wasn't exercising, I was in depression, I was iron deficient, and I was vitamin D deficient, and I wasn't taking care of myself, I wasn't exercising. This was in the last probably 5-6 years, I would say, and I just used to trim my hair regularly to make sure that, you know, the ends were healthy and it looked healthy rather than if it was healthy was my concern. Once I started taking care of myself, I could fix most of my issues. I could fix my skin, I could fix my mood, I could fix my, physical well-being. I did lose weight. So I think a few things still continue to affect me. I was calorie restricting. So calorie restriction can cause hair loss. This is a thing that a lot of people don't know. You don't eat right, or you don't eat enough protein and you are calorie restricting, you can lose weight, because hair is made of protein. Keratin is a protein. So you got to be aware of that. Make sure you have enough protein. I am taking high amount or adequate amount of protein, but still I think it's not enough because the damage has already been done. The number 2 is my hormones. So sometimes testosterone levels are higher as you go into menopause. Your estrogen, progesterone drops. I am on oral contraceptive pill. Despite that, my hair is losing. So I am losing quite a bit of hair, and I can see it's called female pattern hair loss. So when you part your hair, you would see there's a bigger gap. So my gap is not this much and it's growing. So I think it's the starting process of significant female pattern hair loss, and I'm losing my long hair as well. In female pattern hair loss, what you would notice is, you know, the roots of your hair become thin and brittle and the hair easily breaks off, and you often see in the central part of your hair partings, and that is the telltale sign you're about to thin out your hair. What can be done? Make sure you eat enough protein. Make sure your minerals, your vitamins are at good level, such as vitamin D. Your iron is good. You do not have thyroid issues in your body. There are other things you can do. Make sure your hair is trim shop, which is what I'm about to do. So I'm waiting for my appointment for my hair. I trim my hair every 8 weeks. So this time I'm going to really go short. I haven't done a short hair in a long time. I don't think my partner's going to be happy about it. He likes long hair, but I'm going to do it because I want my hair to look healthy, and I want the growing hair that's coming to be healthy as well. So I've started myself 4 weeks ago. I went to my doctor and started myself on minoxidil. Minoxidil reduces the level of testosterone. I did try topical. It wasn't doing anything for me for about 6 months. So I've gone on oral minoxidil. I've started on the lowest dose, 1 milligram. Now, the other thing I would be adding, because I wanted to try the minoxidil and then think about something called spironolactone. Please do consult your doctor. And first thing you need to check is what kind of hair loss you're having. It's not applicable to everyone. This is my middle age issues, and I want to start myself on spironolactone. You start on a small dose of 25 milligram while making sure my hair is taken care of. Hair mask is applied, my diet is right, I'm staying hydrated. These are things you can do to prevent further hair loss. That's something you got to keep in mind. it does not make your hair in most people come back. So also when you start minoxidil, the one thing I've noticed is I'm losing more hair. So in the first 4 to 6 weeks, or the first 6 weeks, you will notice an increased hair loss as your common side effect. Do not stress. That just means the telogenic phase of the hair is reduced, which is the growth, one of the growth phases, and the hair is going to fall off and you will get new hair. So it does stop further hair loss, which is what you want. You don't want the hair to thin out further. There are laser therapies and things like that. Evidence is very, very thin and conflicting. There's a supplement called biotin, and that seems to be one of the best supplements you can take because it increases the keratin levels in your body. Your nail is improved, your hair is improved. So I'm about to go out and get some hair loss, some biotin. Also, trim your hair short, maybe avoid parting in the center, giving a zigzag parting. All of these things that we suggest to patients to do to camouflage it. I don't recommend hair extensions because hair extensions are heavy. Unless you are using a halo hair extension, don't use hair extensions that are, attached to your hair. Even the clip-on ones, they cause stress on your hair roots and actually make you lose hair. Use a toothed comb, that is a wide tooth comb, and clean your comb regularly. Also, make sure that you use hair products that are light and non-drying because dry hair always breaks easily. Use a bloating towel that would actually bloat the moisture rather than damaging it. So avoid rough towels on your hair. And those are my hair care tips.